All right, so post-traumatic stress disorder is a very, very challenging situation for many people, including veterans, abuse victims. I mean, the list goes on and on. You know, a lot of people have trauma which they hide because avoidance is the number one way to deal with trauma because it's really painful to kind of tear away the band-aids and the maladaptive coping mechanisms to deal with the traumatic events in your life. And there's various types of therapy like EMDR or cognitive processing therapy. Even dialectical behavioral therapy is also helpful. There's definitely medicines for it. But let's go over the criteria. So think about this phrase, remembers atrocious nuclear attacks. So the remembers, the R, is re-experience the trauma with intrusive memories, flashbacks, or nightmares. One of them is required for the diagnosis. So avoidance of stimuli associated with trauma. So if you've been in war, you might look in a trash can and be like, I don't want to go into that trash can because it might be a bomb, right? So you like jump to conclusions. The other thing is negative alterations of cognition and mood. So almost seems like depression. So amnesia of trauma, negative beliefs about oneself, irrational blaming oneself for trauma, negative emotional state, restricted interest activities, detachment, inability to have positive emotions. Two are required for the diagnosis. So it seems like depression, but it's almost like they just kind of detached from the world because they've just been so traumatized, and it's just like they don't know how to engage their brain in experiencing positivity. Another thing is arousal increase, such as insomnia, irritability, hypervigilance, startle response, reckless behavior, poor concentration. Two are required for the diagnosis. So again, re-experiencing trauma, avoidance of stimuli, negative alterations of cognitions and mood, arousal increased. So those are the underlying symptoms for PTSD. So one for re-experiencing, two for avoidance of stimuli, two symptoms of negative alterations of mood and cognition, and two for hyperarousal.